to the executive platform. I am your anchor, Dorothy Bassi. Our guest today is Dr. Hassan of Dr. Hassan's Clinic and Diagnostic Center, located at number 5, Eli Crescent, Maitama, Abuja. Before we speak to Dr. Hassan, let us take a quick look at the official launch of the Molecular Pathology Lab here at the Dr. Hassan's Clinic and Diagnostic Center, which was flagged off with a conference on molecular pathology and African perspective. In attendance at the medical conference were experts from South Africa, India, and of course Nigeria. Also in attendance was His Excellency Mr. Mahesh Sakdev, the Indian High Commissioner to Nigeria. I spoke with some of the consulting experts at the conference, and they had this to say.
In South Africa, there are many labs, government and private labs that do this kind of analysis, but if you go more north in South African countries, it's really getting very unused, and especially also in Nigeria, it hasn't been really applied in a larger scale. And our aim is, I have been here, or I'm coming to Nigeria since 3 years, and it's the 5th time I'm now here, and we always tried to find partners where we can actually help, support in getting in this field. And with Dr. Hassan's clinic, luckily that we found somebody who wants to move forward, has the vision to get this off the ground, and we are very pleased to help him and his team in achieving it.
I agree that this is a very important day, and I agree that Nigeria has come of age and we can actually leverage this technology to solve a lot of problems in the country, both medically and socially. So I'm very happy to be associated with today's event, the introduction of these molecular pathology techniques at the Dr. Hassan Clinic here in Abuja. And I hope that these technologies will spread like wildfire in Nigeria, because, as I've said, it will solve a number of problems, both medically and socially.
I also had the distinctive privilege to speak to Dr. Hassan's father, himself a professor of mathematics at the University of Maiduguri. He had this kind words to say about his son.
Dr. Hassan, he came when he was in a primary school.
Oh, to Nigeria?
Yes.
And he's been here since?
He has been since. He got his secondary education and A-level education, and then his MBBS.
All in Nigeria?
All in Nigeria.
Established a hospital in Nigeria?
Established a hospital, and he's a great researcher also. He has got a degree of Doctor of Science. Yes, I am very happy because they have been, actually I tried my best that they should be good. They were very good in mathematics, but they decided to go for medicine. So I said, it's okay. The two brothers,
they're all doctors.
They are doctors. The third one is an engineer. He has a first-class degree in mechanical engineering.
Let us take a quick break, after which we'll come back to the interview with Dr. Hassan.
Baby girl, I know sick of your love in the sweet. See the way you make me feel like saying on my birthday. Hey, you the tingling on my heart. You the tingling.
The same goes. Wherever you go, the cooler it becomes. To what extent is this same parameter? Find out in the executive platform every Wednesday at 1 p.m. and then 8 Saturday at 8:30 p.m. Executive platform provides a forum for chief executives and private and public sector to reflect on issues within the office they occupy. Executive platform, they must watch.
Let's start by talking about Dr. Hassan's clinic.
Well, Dr. Hassan's clinic was set up in 2005. That's about 6 years plus now.
Wow.
In Abuja, and we were in Wuse 2 before.
Oh, you started at Wuse 2?
Yes, it was a smaller setup, but because there was so much pressure, on us to expand, there were so many patients, it was becoming difficult to accommodate people there. That's when we moved here about 2 years back.
Oh, so you only got here 2 years ago?
2 years back.
You've
yes.
done fantastic.
Thank you.
You've done fantastic. And how many beds do you have and the specialties here?
It's a 65-bed hospital.
Okay.
We have almost all the specialties. Of course, internal medicine is there, surgery, orthopedics. We have physiotherapy. We have one of the most advanced laboratories. We do over 500 tests here. And we have a very large team of lab scientists, 11 lab scientists. And the head of the team, of course, Dr. Okara, is also the president of the Association of Lab Scientists in this country. So our lab has got a lot of credibility in the country, and we do so many tests every day. In fact, we get requests from many other clinics and hospitals who send their samples here. Yes, and we have a very large inpatient facility. The total bed capacity is 65.
Okay.
But in that 65, mostly there are single rooms, there are VIP rooms, there are general wards. And we've tried our best to make care as personalized as possible.
Okay.
And also to keep in mind the local culture. We've tried to make as little rules as possible. We get a lot of people coming here. In African culture, when one person is sick, at least 10 people want to follow him,
Well, that's correct.
So we don't say, look, you have only one visitor or two visitors. It's a big hospital. It's spread all over the place, So it's not very difficult for us. We were flexible about that. We allow relatives to come, Sometimes they stay outside. Sometimes they stay in the garden. There are times we've had 20 people with one patient, But we try to be flexible about that,
And as we were walking around the hospital, I noticed you have a very, very well-equipped ICU and cardiology department. Can you talk to me a little bit about what is going on, the patient flow, and how do you see that helping the community?
Well, we have a well-equipped ICU, and what we have tried to do is that even the other patient beds, we have kept some basic ICU facility with all the other beds. Like almost all our beds have cardiac monitors. Normally you will find cardiac monitors only in the ICU.
Yes.
Of course, the ICU is very advanced. We've got the most advanced kind of beds with the cardiac monitors, then the oxygen units that can trap oxygen from the air and then generate, without using a cylinder. They are called oxygen concentrators.
Yes.
So we have a lot of equipment in the ICU, and we get a lot of serious emergencies from all over the country. Very sick patients that need intensive care. And we are hoping that sometime next month our entire cardiac unit will take off, where we may be able to start doing interventional cardiology, taking in patients so that not all patients necessarily have to go outside the country.
That's what I was just going to say. If you have all these subspecialties and you have all these great doctors here, I think that Nigerians really don't need to travel so much outside, because the services are here, and you have the capacity, and you have the doctors that are able to do some of these things that we're traveling out to do.
Actually, that has been my dream all along. I grew up in Nigeria, and my dream has always been that somewhere along the line we should have a situation whereby instead of patients traveling to Delhi or London or New York from here, we should have patients coming, to Abuja from Cameroon and Chad and Ghana. This is where patients should be coming to. This country has the potential.
Yes.
I have been practicing here for nearly 30 years. Nigerian doctors are good doctors. In fact, we have a blend of very good Nigerian and very good Indian doctors. In fact, we have a few other nationalities also.
Wow.
We just tried to create a setup, that everybody will be comfortable with. And a lot of surgeries that before people were going for these surgeries to India, we have started doing them here. So, and then the ultimate aim is that people should be able to do everything here.
Could you give me examples of some of the surgeries that you're able to do here now that you weren't doing before?
You see, I'm also the panel doctor for the Indian High Commission.
Okay.
So I have been involved in the process of people traveling outside the country. Sometimes what happens is that it is not simply because the facility is not available in the country. Sometimes it's the confidence in the system.
Okay.
You know, we had this situation in India 20 years ago. I was in Nigeria. If I asked somebody to go to Delhi in 1995, they will not go. They will tell me, sir, please send me to London. You know.
Wow.
But now when you want to send somebody to London or Frankfurt, they will tell you, no, send me to Bangalore or Delhi.
How was India able to do that?
It is basically, you know, the private sector. Once the private sector is strong and the facilities are there and the costs are reasonable, people will ultimately develop confidence. If somebody is going to have surgery, it's a lot easier to have that surgery within your own hometown rather than have to go 10,000 kilometers away, because your relatives can visit you. You don't have to travel with a few people, you know, 3-4 days, like fibroids. We are doing a lot of fibroids here.
Okay.
Before, I remember people used to go abroad for fibroids. But fibroid surgery was available in Nigeria in almost all the hospitals before. But a lot of people who could afford it wanted to go out. Yeah. So it's just the confidence in the system. We've started doing painless hemorrhoidectomies, which has become very popular, because hemorrhoids is one condition where, you know, people are very uncomfortable. They shy away from going to the hospital because it's embarrassing.
It is.
And it's painful, you know. So there's so many things involved in this. So people just suffer silently. And then they know if they go to the hospital, you have to stay there for a week, you know, it's messy, it's painful. Now we do painless hemorrhoid surgeries. Patients come in the morning, we finish the surgery, there is no bleeding, there is no pain, and in the evening they go home.
Wow, so it's like same-day surgery.
Exactly. So we're trying to bring in most of the advanced technology related to all the fields of medicine, just like what we did last week. You know, we started the process of setting up a very advanced molecular diagnostic center, which will be the first of its kind in this country. So basically, this has been my dream, that we want, instead of people traveling outside the country, because I know this country has the potential. Nigerian doctors are good doctors. In fact, I read somewhere that there are 30,000 Nigerian doctors practicing in the United States.
Of course.
And this is just United States. In the Middle East, hospitals in the Middle East, hospitals in UK. So the manpower is there, the resources are there. I think as soon as patients start developing confidence in the system locally, and this is how it happens, this is how it happened in India. People have confidence in our hospital now. People come to me and tell me, doctor, this is what I've been diagnosed with. Can we do the surgery here, or do I have to go out? I tell them, no, we can do the surgery. So, okay, whatever you say. So this is the confidence in the system. I know this same surgery is being done in other hospitals in Abuja, but they want me to say it. You know, if I say, okay, let's do it here, they will say it's fine.
Well, that's good.
So, but this thing will happen, and it will go, ultimately it will go around all the hospitals. By the time people have confidence in one hospital in Abuja, then it will be 2 and 3 and 4, and then gradually you will see that people will start getting their treatment within the country rather than going abroad.
That's good. Now that we've talked about that, let's talk a little bit about you. When I talked to your dad earlier, he's been here 50 years, and you've been here quite a long time. So should I assume you're a Nigerian or you're Indian? Which one?
I consider myself a Nigerian. You see, I speak Hausa fluently.
Wow.
Most of my friends are Nigerians. I have grown up here. I studied here. So this is home. I feel comfortable. You know, when I go to India, I meet my relatives. I enjoy it. I've always been in touch with them. We talk to them every day. But when I land in Abuja, when I'm coming back, then I get that feeling that I have come home. So I consider myself a Nigerian, and my friends consider me a Nigerian also.
That's nice. Yes. I know you couldn't be so successful. There must be someone behind, your family. Could you let us in a little bit on it?
My parents, actually, I would say my parents, you know, have contributed a lot, you know, towards my personal development and that of my brothers and sisters. You know, my father is an educationist. My mother comes from a family of educationists, you know. They have given us this silent support, you know, all along, never interfering, you know, never dominating us, you know, but always there, you know, helping us to take the right decisions, you know, if we take a decision, you know, going along with us. So I think that silent support and their prayers.
That's what is. Yes. Investing in medicine Because ultimately, hospital is a business. Why a hospital? Why Abuja? Why Nigeria at this time?
Well, I think it's very simple. You see, I'm a doctor. My younger brother, Dr. Zia, is a doctor.
Okay.
Yeah, so obviously the thing that we do best is treat people, you know. And I selected Abuja because I have patients all over the country.
Okay.
And this is a more central place. So I thought if I am here, people can come and see me. It's a lot easier for people to come to Abuja from the northwest, from the northeast, from Lagos. In fact, almost every day I have patients who come from Lagos, Port Harcourt, Yola, Sokoto, and they phone me. Then I just tell them, and they just take the first flight and come in the morning, stay for a day, if necessary stay the next day, and then they go back. So this is a central place. So the idea of setting up a hospital here was because of the location.
Have you lived in any other parts of Nigeria?
Oh, in many places. I've lived in Yola. I grew up in Yola. Yes, I grew up in Yola. I've worked at the teaching hospital in Maitama.
Okay.
I've stayed in Kaduna. Yes. And of course, there was a time in the late 90s when I was basically, you know, consulting for many countries around the country. So I used to go to Lagos and Kano and many other places. Yes.
Earlier on when we were speaking, you mentioned about the Molecular Diagnostic Center, and I'd like just for you to elaborate a little bit on that.
Actually, molecular diagnostics is the future of laboratory sciences in medicine. You know, these are the most advanced kind of tests. You must have heard, you know, where tests are done to determine who the father of a child is.
Yes, of course, yeah.
So this is to do with DNAs. But it goes beyond that. This is not just about DNA testing to see who the parents are, you know. With molecular diagnostics, you could detect a person who is going to become a diabetic 10 years from now.
Wow.
Before he's actually become a diabetic. And you know, it's very helpful in cancer screening. You can detect cancers at a very early stage. It's very helpful in the diagnosis of tuberculosis, you know, hepatitis, and especially, you know, the human papilloma virus, the HPV, which is implicated in causing cervical cancers. Cervical cancer is common. It is one of the few, probably the only preventable cancer. There are vaccines available now. We have vaccines that we give to people. We use pap smears to test people and see is there a potential that this person might develop cancer along the line, and then, you know, we give vaccines. But with the presence of molecular diagnostic facilities here, we will be able to detect the presence of the virus itself long before it can actually develop into cancer.
Well, I think besides that also, the potential for solving and resolving crimes and stuff like that.
Sure, yes.
And now maybe Nigerians don't need to go, you know, send their DNAs outside anymore.
It has a huge role in forensic medicine. You know?
Yes.
Yes. In crime detection, you know, so we could be very helpful to the crime departments, to the courts, yeah. But essentially, to the but disease, you know, just disease itself.
Prevention.
You know, disease prevention, especially cancers, diabetes, tuberculosis, hepatitis, you know, serious illnesses can be picked long before, you know, they become serious.
That's very interesting. And what about the cost implication?
No, I don't think, you see, the whole of medical practice, my experience is that the whole of medical practice, the cost implications, costs are not as high as people think, you know. Basically, what you need to do is you need to have competent people to run the thing. Like we took this step. I'm sure there are a lot of people who can afford to set up a molecular diagnostic laboratory in this country. But we have a team that can take care of this. We have a team of very good scientists. We have somebody sitting on top of that team, you know, that has been trained abroad, trained here. He has a lot of experience. These are people who can handle these equipments. So it's the manpower that is more important. Molecular diagnostics, you see, if you want, there are certain tests and things for which people travel abroad. The cost of the test is not even 1/10 the cost of traveling abroad, you know, just the air tickets. So if you look at it that way, in the long run, it is not expensive.
Well, that's interesting. We went around and I see that there's a very friendly air between the management, the medical team, the parastatals, the other unlicensed staff. How have you managed to keep that relationship?
Actually, I don't believe in formalities, and that is why we don't have any bureaucracy here. Yeah, and we try to mix as much as possible. The most junior doctors have free access to me, even on patient. When we have a hierarchy, we have people, they are supposed to get in touch with, who are supposed to get in touch with the next set of people. But we've made it in such a way that everybody interacts with each other. And even for patients, where a staff is not directly involved in patient care, we encourage people to interact with patients, go and greet them, meet them, ask them, because sometimes a third party can find things better. Even our accountants, when they are free, sometimes they will walk in, go into a room, just talk to the patients, are you okay, do you have a problem, So at the end of the day, again, it is the culture from which I come. You see, the Nigerian culture and the rural Indian culture. I come from a village in India, So everything is personalized. So we have tried to extend that to our patients and to our staff also. In fact, all our staff are like a family.